Raise your glasses, whether it's eggnog or champagne, but not water. That'd be bad luck. The holidays, they are for toasting. It's estimated that all those toasts add up. Americans drink double their typical amount of alcohol during this time of the year.
Wow.
Yeah, but all that extra booze could harm your health. Chief medical correspondent and killjoy, Dr. Jon LaPook, is here to set the record straight about the health consequences of drinking. Doctor, I'm giving you a hard time. I know there are health consequences, but it's hard to keep track of whether alcohol in moderation is good for you or not. Red wine, for example, is that good for your heart or not?
Well, you know, it's gotten murkier because in the 90s, there were some studies saying, you know, if you drink red wine, it's good for your heart. Now it turns out when you look back at those studies, there were some design problems. It was an association, but was it cause and effect? And the people who were having the red wine and being healthier, they could have been doing other things like have a healthier lifestyle, exercise.
Where did that
it's not clear.
even come from, that idea? Like, you know, people associate it with the French,
The
right?
French paradox, which was, we did a 60 Minutes piece about it 30 years ago, which was that people who had saturated fat there, and yet they were healthy. You know, they were heart healthy.
And you're not actually a killjoy. You're one of the most joyful people I know. You sing, you dance, you've got a great sense of humor.
Are you feeling bad about calling him a killjoy right now?
Because killjoy is such a tough word. It's a tough word.
Dr. Killjoy, my friend.
No, but you're actually like a lot of fun and a barrel of laughs. But you're just hoping people understand that when you start to drink, there are consequences. They need to be. There's a cost benefit.
Yeah, you know, the World Health Organization said there's no safe amount of alcohol. And it makes sense. I actually did a deep dive on the chemistry of it, which is really interesting and a little bit depressing because alcohol is a real toxin and it can get inside of cells.
Oh, wow.
And inside of cells, it can cause damage to the mitochondria, which make energy. They're the powerhouses of the cells. To the DNA, which can be important in terms of cancer, right? Well, we know that there's increased cancer from alcohol anywhere from your throat, esophagus, stomach, colon, and including breast cancer. There's no safe amount of alcohol in terms of breast cancer risk.
So, Dr. LaPook, may I ask you a personal question?
Yes.
Do you drink?
Yeah, I mean, I'm not a big drinker. I'll have a drink here and there socially. And I think this brings us to the point, you know, you're obliquely asking, are we supposed to not drink at all? And I think we live in a society where it's deeply ingrained alcohol at times into our society. And prohibition, let's see, did that work? It did not work, okay?
No.
So I think it's just a matter of people making decisions for themselves and understanding it's not risk-free. There are some risks, but I guess less is more in terms of alcohol risk. And somebody may make the decision, look, I'm gonna do that for me.
So what are some ideas people can take with them to drink safely?
Yeah, I'll tell you, and again, I looked at the chemistry of this last night. One of the most obvious things is just to have a plan when you're coming in. And if your stomach is full of food, especially fatty food, it decreases the emptying, and about 80% of the alcohol is absorbed not in the stomach, but in the small intestine.
Interesting.
So what happens when you go into a party, right? They hand you a drink. Oh, you have nothing in your stomach, you drink. Now what does alcohol do? It disinhibits you. So you drink more, you eat more, and you're off to the races. And then I would say the other thing is, and it's a big misconception, don't drink and drive, obviously, but the thought, well, if I have some coffee, it'll sober me up. Coffee will not sober you up. In fact, it may make you a little bit more alert so you can drink some more and be deluded thinking that you're not impaired, where you are impaired.
Wow.
No, that's
okay.
really good for you to clear up. But with the eating part, your version of pre-gaming is eat a big meal, fatty foods before you drink.
Yeah, I would say have something in your stomach and have a plan. Say I'm going to come in here and not like, well, whatever happens, happens. I'm going to think about what I'm going to do. And the first drink should be with something in your stomach, I think.
All right. He's an aperitif guy. He's
and hydrate. Hydrate.
All right. That's a big one.
Next time we get together, that's what we're going to do.
I want to talk about hangover cures next time you're here.
Oh, yeah, there's stuff to be said.
All right, Dr. Jon LaPook, thank you so much.